who wants to start it off?
Okay. So we are group VN67 doing the presentation on aspirating a foreign object. I am Andrea Murillo.
My,
Shapri Kanti.
Dolores Santos.
Rahab Gebigia.
Ravinder Gill. Okay, and we'll start.
Okay, the first thing we have. Oh, okay. The first thing we have is relevant medical and nursing facts. Basically, aspirating a foreign object can be a life-threatening emergency to the patient if we're not careful. Um, Depending on the situation. Mistakes can happen in the nursing field that can cause the patient to get to that point if we're not careful and not paying attention to what we are doing. It can get lodged in the larynx or the trachea to the point where they are unable to speak clearly. If the object is too large, it can cause asphyxia, which can result in death because the patient's airway can nearly be obstructed. And then we have more on nursing facts. Also, distractions are a big part in patients aspirating a foreign object. For example, like checking your phone during work, talking to other nurses, etc. Like all things like that. And then, according to the article Foreign Body Aspiration, written by ADA's medical knowledge team, it states initial treatment usually focuses on managing the person's ability to breathe properly before moving on to removal of the foreign body. So basically, that means um, it means that when a person aspirates a foreign object, the first thing to do is determine if that person is able to breathe properly or not, and that will indicate how serious the situation is. Checking the person's breathing is essential before um, moving any object.
The primary cause of this injury. So the primary cause of this injury was aspirating a foreign object. This object was aluminum. In this case, when a nurse was doing a med pass, this was caused for her. This was caused because the nurse was distracted as she was doing her med passes. Two other nurses came up to her and started talking about non-related work activities and resulted in her administering and giving the patient medication that had aluminum in her cup. This could have been prevented if the nurse witnessed when the patient was taking her medications because she could have noticed the foreign object on the cup. So, a continuation of this, the primary, oh, sorry. Another important factor was that all the patient's medications were all in one cup. The correct way to pass medications to a patient would have been one pill in one cup, and so on.
Solutions to prevent incidents of aspirating a foreign object. So, for patients, avoid talking, laughing, or playing when eating. Avoid putting non edible objects into the mouth and always eat slowly. So, in this case, nurses need to thoroughly pay attention when passing out any medications to patients or residents. Minimize any clutter on the med cart when passing meds to ensure no foreign object has came in contact with any meds. Have a second pair of eyes, verify the medication being passed, and lastly, direct all attention to passing medications and minimize any and all distractions.
Sentinel event data released for 2021 indicates that 46% of the Sentinel events led to a patient's death, 24% led to unexpected additional care, 12% led to severe temporary harm, 6% led to permanent loss of function.
Ravinder.
So this is a real story when I was young. So what happened when my younger brother was playing? So he got his toy stuck in his throat and he started choking. Then my mom noticed it right away, and she quickly like backward and upward thrust my brother on his back, and then the toy came out right away before it was too late. So we are really glad that we saved my brother. And yeah, thank you.
Choking on something. Choking on something. How long has he been choking? I don't know. A few minutes? 5? It's been true. The baby's been maybe like about too long. Next time, call.
So these are the some questions that we should always keep in mind if something like this happen. So the first question is, what is the first priority in managing lower airway obstruction? And how can you identify and check patients' airway obstruction? How can an airway blockage be prevented?
All right, that includes our presentation. Here's the reference page that we use to get our information from. And yeah, thank you for watching.
Thank you.
Thank you.